me just tell you, first of all, we want to thank him for also getting so dressed up for us this evening. As you can tell, he's wearing a sports coat, which he didn't have to wear, but he decided to, and we appreciate his work, his efforts, his commitment, his passion for people, his passion for the truth. I don't think anybody can give him a proper introduction. But ladies and gentlemen, please join me in welcoming none other than our good friend, a great American, Michael Moore.
I wore this jacket because I thought it was going to be cold today. I thank you very much, Speaker Nunez, and the other assemblymen and women and senators who are here today and who have invited me to the state capitol to screen my movie for the elected representatives of the people of California. I just had an excellent meeting with the Speaker and his fellow representatives and senators here. And we discussed the upcoming bills before the state legislature and the goal of California, once again, taking the lead for the United States in what needs to happen to have a more humane society. California has, in the past, been at the forefront of raising the minimum wage, of demanding pollution controls, so many things. You could just go down a long list of what initially began in this state. And it's my sincere hope that California will once again lead the way in taking on the private profit-making companies that are gouging the citizens of this state and this country to line their pockets at the expense of those who are sick, who are ill, and who need help. And when you just mentioned the statistic here earlier about the 6.8 million that aren't even covered in this state, I just did the math on that. The 47 million who are not covered in the United States, that's 1 in 7 live in this state. That's an appalling statistic.
800,000.
And 800,000 children. 800,000 children, 9 million nationwide. What society wouldn't at least say the children should be able to see a doctor if they get sick and their parents not have to worry about paying for it? In my movie, you'll see tonight that we are now in a state, this state, California, where hospitals believe that they can take patients out of their beds who can't pay their bills and put them in a taxi or a van and dump them off on Skid Row in Los Angeles. And what was their crime? They don't live on Skid Row. Their crime was that they couldn't pay the bill. And because they couldn't pay the bill, and in the film you'll see I have the security camera footage. You've probably seen it out here. The rest of America hasn't seen it. They need to see what goes on and why these companies, I'm sure many of you remember when you were younger, the hospitals that were owned by the city or the good nuns, it was about taking care of people. The question, if we treat this person, how will this affect our bottom line, was never asked. And yet that is the question that's asked now. Because these companies, whether they're the health insurance companies, the pharmaceutical companies, the hospital corporations, they have legally a fiduciary responsibility to maximize the shareholder profits. They have to make as much money as possible or they're breaking the law. And to have the concept of profit enter into a discussion as to whether or not people should get help when they're sick is antithetical to basic human rights. And in every other Western industrialized country on this planet, they consider it a human right that if you get sick, you have a right to see a doctor and not have to worry about paying for it. Now, we're the wealthiest country on earth, and we are the United States of America. And I do not understand why we allow this problem to continue. Now, Speaker Nunez and his fellow assemblymen and the senators here with us today are not going to have an easy go of it. Because as Blue Cross has already announced, and from what I understand perhaps has already spent, $2 million is in their campaign to fight both the Democrats' plan and the governor's plan. They don't even like the Republican plan. That's how afraid they are that the people of this state and this country are going to stand up and demand that we fix this broken healthcare system that has a death grip on the people of this country. 18,000 people, according to the latest statistics, 18,000 people a year die in America for one simple reason. They don't have a health insurance card. They would have lived had they had insurance, had they gone and gotten help at the first sign of trouble, but they don't because they don't have insurance. That has to change. If we're going to call ourselves a free society, a humane society, that has to change. And we have to remove the concept of profit from this. So my own personal feelings, and I'm not here, I'm not a legislator, I'm not writing bills, I'm not doing any of this.
You make a good,
But,
you make a good.
I don't know about that, but certainly I would meet the height requirement of, but basically I'm pushing for three simple things. Number one, health care for everyone in America, guaranteed and not denied to a single person who resides in this great country. Number two, remove the profit-making insurance companies from the equation. They no longer should be able to call the shots. There's no room for them in this equation. And number three, I want the pharmaceutical companies strictly regulated. I want them regulated like a public utility. Just as we need medicine to survive, as you need heat in the winter and you need electricity, you need medicine. But the people that are the purveyors of this medicine, they determine the cost of things and they have to be regulated. And as I was just explaining to the speaker, 30 years ago, 25 pharmaceutical companies were looking for cures and vaccines. Today, there are only 5 that are looking for cures and vaccines because there's no money in it. Because once you cure somebody, they're not on the pills for the next 60, 70 years. So that has to change, those three things. And I just want to say, before I guess we're going to open up to some questions, how grateful I am to you, to the people behind you here, to the nurses who are here with us today, to Senator Kuehl, her bill for universal health care. All these things I think are really a very positive step forward. And I'm sure between all of you, you're going to find the right solution for California and act as a beacon of hope for the rest of this country. So thank you very much.
Just so you know, we only have time for a couple of